Going to the doctor's office or hospitals, that can get pricey, very expensive, and it can drive people and families even into bankruptcy. Now the deaths of a couple in Washington are being investigated as a murder-suicide, all because of mounting hospital bills. Deputies in Whatcom County found Brian Jones and his wife Patricia dead in their home this week. They say Jones left several notes saying they could not afford medical care for his wife. Dr. Jen Caudle joins us now to talk more about this sad situation. Good morning. I'm glad you're with us. But to think that even medical bills could drive someone to this extent.
Yeah, I mean, honestly, in reaction to the story, I have one word, which is devastating.
Yeah.
Right? It's absolutely devastating. And even seeing reactions on social media, I posted this story on my Facebook page to get people's reactions. Not only does everyone find it devastating, but it's more common maybe than we understand. This idea of being stressed out over medical bills.
Are there things that you can do when it gets to the point where it's just too much? What are the options?
Yeah, you know, there are options. And I do want to say, Cheyenne, you know, there's a number of things that as a family physician that I often see. You know, it's not necessarily what we're seeing in this tragic case. Sometimes there are other things. Sometimes patients skip taking medications or they space them out to try to preserve. Sometimes they don't come to the doctor to try to sort of minimize costs. I've had patients say that they've gone into bankruptcy, and people commenting. So to answer your question, though, I think talking about this is really important. And I know the word talking gets overrated, but quite honestly, as a physician, I appreciate it when my patients tell me they're struggling. When they say, hey, doc, this medication costs me this much money, I can't afford it. It helps me help them by either sometimes prescribing other medications, altering our plan in a way that makes sense, getting them to social work, human resources, things like that, and other programs. So there are programs in the community sometimes that can help us, and that's really what my goal is, certainly.
And you're saying, you know, things like this are happening more too often than they should.
Yes.
Is this a sign of a broken healthcare system?
You know, look, I think I'd be remiss if I said no.
Yeah.
I think yes. That this is clearly a problem. Clearly, if people are feeling to the point where that taking their own lives or the lives of other people is the only way to escape mounting medical debt, then that is clearly a problem. And even some of the things that I mentioned before, skipping medications, etc., not getting necessary tests done, delaying care, these are all problems. And it's a symptom. You know, there's a lot of work to be done on our healthcare system. And the other thing I should say too is, as we live longer, as we get older, I have patients well into their 70s that work a job. They're not retired, or they retired and they went back to work because it's the only way they can pay their medical bills. So, you know, as you can see, I'm pretty passionate about this topic, and it breaks my heart. There's nothing worse. Well, there are things worse, but I'll tell you, as a family doctor, you don't feel any more helpless than when you're staring at a patient saying, we need to do this, we need to do that, I need this for you, I want this for you, and they say, I can't. I just can't.
Especially when it comes down to affordability.
Right, and it's their health, it's their lives. So there's a lot that needs to be done, and this is where community resources need to be coming into play. And this is where I say, for patients and people out there, if you are out there, I'm talking to you, and your medical costs are too expensive, you're really sinking, you're underwater, please tell someone. There are often things that we can do, even little things to help. And also, I know I keep going on and on and on, but like, this is so important. This also raises importance about mental health, right? The other part of this is mental health and how we cope with stress and even suicide awareness. So if you're feeling like whatever the issue is, you're not making it, there's a suicide prevention hotline. I know it's 1-800-273-TALK, but talking to your doctor, someone you trust, is so important.
Yes, absolutely. If anyone out there, again, if you're contemplating suicide, you can reach out to the National Suicide Prevention Hotline, the number right there on your screen. Dr. Caudle, thank you so much for your time today. I appreciate it.
Thank you.